Hello, welcome to episode 4 of the Medical Receptionist Network podcast show. My name is Shivhon Adkins, and I am your host for today. We're going to be discussing customer service at the front desk and just touch on a few topics that are very specific to front desk and medical receptionists in a medical office setting. If you have not had an opportunity to receive your medical receptionist handbook to success, please hop over to medicalreceptionistnetwork.com, or you can search us in amazon.com, and we even have the handbook available on Kindle. So please, definitely go out there and get that so you can get some useful tools and tips that will assist you in your growth with your employer. And if you're a manager or a physician, maybe your employees could benefit from the Medical Receptionist Network Handbook to Success. So we encourage everyone to go and get your hands on one of those. So customer service. Customer service is such a broad topic because it pretty much applies to every area in our life. Every area, everything we do, everywhere we go. If there's an exchange with another person, or for a service or a fee or anything, there is some customer service involved. So when it comes to healthcare, obviously you're more so looking at the patient front desk interaction, and what are some of the things that a medical receptionist can do initially just to provide that stellar type of service. Obviously being courteous to your I can call them customers in this case, but your patients, right? Your clients that walk in the door. And it really starts there, as we've discussed. You have to be welcoming, be pleasant, let them know they're welcome, in this office, and you're going to do everything you can do to help them get through the process. But also in being courteous and being friendly, or being welcoming and warm, you also have to be understanding that all patients aren't the same. They are not coming from the same level of understanding. They're not coming from the same place, in their life, in their health. So, while one patient may come in, grab the paperwork, take care of it really fast, and sit back down, give you anything you need, their insurance card, payment, maybe you need their social security card, whatever it is that your office, expects. But you may have someone else who comes in and they're moving very slowly. They're asking a lot of questions. They don't quite understand what you're asking. They're flipping around in their purse, or, they got to call their wife because they don't have their insurance card. Things like that sometimes, make you feel like, okay, this is slowing us down. However, you have to be understanding to everyone's situation and just really come up with ways to accommodate that person. Okay, what is it that we need, or do, instead of asking for multiple things at once, ask them for one thing at a time. If you see someone struggling for whatever the reason may be, ask for one document at a time. Give them a second to put it away. If someone needs to call home for something, maybe you look in your records and say, okay, we may have it from last visit if they're revisiting patient. Just different things. Like, always think outside the box. Don't, make them feel uncomfortable and like, they're being a hindrance to you, because we know you have a job to do, and it's very important that you are able to move fairly quickly and move on to the next patient if there are other people waiting. However, that patient is just as important. So you have to, give them that time, give them some focus, and be understanding of their situation, their age, maybe their illness, or maybe their mental state, just depending on, whether they may be using a wheelchair or something to help them walk, and they don't have all their hands free, or whatever the case may be. You just have to be very mindful of that and understanding. And another thing with customer service is to listen. If someone approaches you, whether it be on the phone, up front, with a concern, make sure you listen carefully before you're ready to respond. Because if you're just sitting there waiting to answer them back, you're not listening. You're not, taking in what their concern may be, or you may be missing an important piece of what they're saying, to where you would be able to actually answer them better, assist them better, support their issue better. So just sometimes take a second to listen, and really grasp what the patient is trying to relate to you. Another way we provide great customer service in a healthcare setting, especially at the front desk, is going to be by solving problems and providing support, by way of, it may not be something you can do, but you are going to be able to connect them with other people in your office who can answer questions, who can provide certain information, who can perform certain actions that they may request. And so that's very important. If you don't have the answer, always know where to get those answers. And I could probably not preach about this enough, because sometimes, if someone calls, they have a question, they speak to 3 different people before they get an answer. We have to cut that out. That is not an efficient way to run an office. That's not an efficient way to, have your patients, provide your patients a quality customer service experience, So knowing who knows what and where to get that information and how to get that patient what they need as soon as possible, or even if it has to do, maybe not with a patient, maybe it's another physician's office calling your office, maybe it's a hospital. Just knowing who handles certain things in your office is extremely important, because if you just assume, okay, boop, I'm going to transfer you here, you transfer them to someone who has no idea what they're talking about. Now they get transferred again, and I think we've all, even as customers, on our own, in our own life, have experienced that, where you get transferred and disconnected, and all these things happen, and it just causes frustration, and it looks very I can't think of the word I want to use, but you're not providing an adequate level of service. It's just not, and it looks bad. It looks bad for the practice. It looks bad for what have you all been trained into, where no one can get me to the one person who can answer this question. So knowledge is key, and understanding the ongoings in your office and the processes in different departments is very important. And we talk about all that in the medical receptionist handbook as well as our training program. Another thing I would say, treat everyone with respect. Sometimes you're going to encounter situations that are not, typical for a medical office or a healthcare setting or a surgical center, whatever the case may be, but you still have to handle that professionally, and you have to be able to recognize when something's going to get out of hand. But right now, we're really focusing on the customer service and treating people with respect. I think one of the best things you can do is be respectful of others, and most of the time you will receive that same respect back. And when you don't, there's no reason to go down to a level that is not becoming of you, that is not professional, that is, out of character, or some would say. There's no reason to do that. I would definitely always take the high road when you can, because there are other ways to deal with these types of situations. In healthcare, there's going to be management, there's going to be other people who can assist you when it goes beyond what you can handle, at the front desk with other people around, and, having maybe, patients on the phone. And if someone's being disrespectful and rude in your waiting area or at your front desk, or they're yelling and things like that, you should have policies and procedures to handle those type of things. But, the same level of respect should go across the board. Young patients, old patients, men, women, children, it should really be that same level of respect all the time, and see everyone in that same light. And then you won't have to think about how to treat someone, because you treat them all the same. And to me, that's very important in a practice, because you never know, if you treat one person one way and they call their friend and say, I went into the office today and I met Susan at the front desk, and she was rude to me, and she didn't listen to what I had to say. And then she's talking to her friend, and Barbara says, oh, well, every time I go, she's really, really nice to me. So you want to have that even level of service, even level of respect, even level of service quality that you're offering to patients. So that way you keep the standard high, you're doing your part in the whole center of the quality service that your office provides, even as far as clinical and your lab services or whatever other services are offered. You are part of that as well, and it starts with you. So that's very important. Always consider their privacy, which we've discussed before. Consider the patient's privacy when they're speaking with you. It doesn't matter if they're speaking loud. You don't have to speak loudly. If you're asking something sensitive, make sure you're keeping that, between the two of you, right at your station or wherever you are, depending on the setup of your office. Sometimes it's difficult if you have a smaller waiting area and patients are sitting pretty much 2 feet away from you, which hopefully is not the case, but sometimes it just is. So, always be mindful of their privacy, of their paperwork, their documents, their medical concerns, their phone numbers, and all of that. So always be mindful, and I think that is a part of customer service, especially in medical settings, because that is such an important part of our responsibility, is protecting that and making sure that we are guarding that information for the patients. Um, respond to requests in a timely fashion. So basically, that means if a patient comes in and they ask you, for maybe they ask for some test results. Maybe they ask to request a callback from a nurse because they have a question. Make sure that if it's something that you have to do directly, that you do it as soon as you can. Sometimes I've seen where someone would maybe take a message, patient needs something faxed to another provider, or they need a copy of this lab for their next cardiology appointment. And they will put these things to the side. And the bottom line is some of those requests would literally take 2 minutes to complete, right? So as a rule, which I don't remember where this came from, anything that takes 2 minutes, you should do it right away. And, these are the type of requests I'm talking about. Get them done in a timely fashion. The minute you have a second, look at your notes or, any messages that you have, and go ahead and take care of that. Just take care of it. And following up with patients is very important. If someone gives you a message that needs to go to a nurse, doctor, manager, or, other clinical provider, those should, be sent along right away. I don't expect that you're waiting to do that till the end of the day. That to me should be kind of a fluid process. You take the message, you get handed off. But if it's something that you're handling directly, whatever, I don't know if your office has a policy, maybe certain requests have to be done in 24 hours, certain things 48 hours. And sometimes when you have those lengths of time, we take advantage of that and just let 10 things stack up and do them at the very last minute. So everyone's getting them on day 2, hour 47 or something like that. But, sometimes if you just focused in and said, okay, this is going to take me 3 minutes to complete. The waiting area is very quiet. We have some downtime. Phones aren't ringing. Let me take care of this. Use those moments to take care of those things so you don't get backed up, because other things may happen in the time where you think, oh, I have all this time. And then there's something takes place in the office that really puts you in a whirlwind. And now you have all this, all these messages or all these requests that are stacked up that you didn't take care of right away because you thought you would have time later. So just kind of keeping on top of things. And if you're handling requests directly for the patient or their family or what have you, follow-up is very important. If someone calls you and they ask you to send something, or they ask you to just find out a piece of information, maybe it requires you to just pull something from the chart, or print something from their insurance records or something like that. Once you do that and you've completed it, let them know. Give them a call and say, hi, Miss Johnson, I just wanted to let you know I faxed your test results over to your cardiologist. Whether they are expecting you to do that or not, it's always good, because sometimes what happens is someone asks you to do something. You say, yes, I'll take care of it. On the way to the doctor's office, they're calling your office again just to make sure that you did what you said you would do. So you can cut that off by doing it in the time when you have availability, where you're free to do it, and you give them that, 20-second call back, letting them know it was done. So when they get to the office, they are pretty positive that you took care of that, and they can tell their office, no, I spoke to, Susan at the front desk, and she confirmed that she faxed it over this afternoon. So that lets them know that she followed up, you talked to her, and they need to look for it on their end, right? So it just sometimes cuts out the back and forth, and then the patient feels like, oh, wow, it was great that they let me know. I didn't even have to make that extra call or deal with going to the office and it not being there or not being ready. And, those things happen. It's not always going to be a perfect scenario. However, there are ways to, kind of be on top of that kind of stuff, and that, those are the things patients remember. If they know time after time they've needed things from you and you've made sure it happened in a timely fashion by when, it was requested or required, that's great. It looks great for the office. It shows that you're being professional. You care about what your patients' needs are, right, for their health, so they can keep having continuity of their care with their other specialist providers. Go the extra mile. Sometimes people try to do the bare minimum when it comes to their job's description and all their duties. But sometimes going the extra mile doesn't only help your patients, your customers, your managers. It'll help you as well. It will make your job just a little less stressful. People will notice that you care. People will be happy to walk into your practice or your facility and understand. They know that these people work really hard. They are focused. They want to make sure that our healthcare is a priority, that our needs are met, and that whatever it is, when you're going the extra mile, whether you're letting them know about delays, whether you're letting them know that there's impending weather coming, we may need to reschedule your appointment, whether you are calling them about something that maybe you were expecting some information from one of their physicians and you didn't receive it, and maybe you don't have the information to contact their doctor, so you call them and say, hey, I see you have an appointment tomorrow to review these results. We don't have them on file yet. Those little things, just take those extra steps, because it's going to make sometimes it's going to make your day better and your workflow better. Because if the patient walks in, again, now just like it could happen in the other direction, it can happen to you. They walk in, they're expecting all this results and paperwork to be there, and it's not. So now everyone's busy trying to make calls, and now you're running into their appointment time. The patient's getting frustrated. You now have to take time away from your station and maybe make some calls, send a fax request for medical records, and just things like that. It just, it can kind of disrupt the process. So trying to be on top of that and being aware and proactive is very helpful to the process of your front desk. And just a couple of things from the medical receptionist handbook that I focus on with customer service is acknowledgement, which is acknowledging your patients, their presence when they're coming in, always, being present, being aware that people are coming in, that you're speaking to them, you're acknowledging them, you're speaking to them and letting them know that you are aware that they're there, so they can get taken care of or triaged or whatever is required. You take action, whatever that action is. If they need to be seen, if they're in a crisis moment, if they're in an emergency, that you're taking action to get any clinical staff, that you are making sure you can identify the patient, and the next one will be to assist them, that you assist them with anything that they need, whether it's their paperwork, whether it's, just to know how long the wait is, whether they have questions about what their appointment entails today. Maybe they have some questions about that, or if they're having a procedure, maybe they're looking for, to speak to a nurse or a medical assistant before they go in, anything like that. But that you're acknowledging them, you're taking action, you're assisting them, and you're explaining to them anything that they need to know within your job, within your ability, right, and your knowledge base, and also that you are always equipped with that information. The more you know, the more you're able to be of value to the practice, to the patient, to yourself. And you're so much more resourceful and so much more self-reliant when you have all the information that you need from your practice. So like I said, customer service is quite expansive. We could go on for days talking about different ways to have your customer service be excellent in your practice. But those are some of the basic things that I think are very important when it comes to a healthcare, medical, and front desk setting. So again, thank you so much. This is episode 4 of Medical Receptionist Network podcast. I'm Shivhon Adkins. Please visit our website at www.medicalreceptionistnetwork.com, and I will see you next week. Thank you.